All right. So Jimmy McKenna asked me to run the meeting tonight since he's out of town, so you get the second person running today. But I would like to call the meeting to order, and we'll start with the Pledge of Allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Rhonda, the roll call.
Jeff DePass.
Here.
Dr. Turner.
Present.
Dr. Lim.
Present.
Dr. Caddick.
Present.
Dr. Ross. Mr. McCannon. Mr. Kyleman. Dr. Brucken.
Present.
And Joni Wise.
Present.
Great. Has everyone had a chance to read through the minutes from the last meeting? Are there any concerns?
They've been approved as submitted.
Second.
All those in favor?
Aye.
Opposed? Meeting's passed. All right, Rhonda, do you have the financial report?
All right, on your financials, you're gonna see three lines in yellow. Come January 1st, that will go down to one yellow line. And it will all be the HFI, which is the Health Fund Indiana account. We'll also, in that account, receive over 1.2 million at that time. And then we are operating off of this year's and the settlement for the rest of the year. Okay?
So what used to be the Health Maintenance Fund and the Health Trust Fund
Yep.
will now go into the HFI account. And those two accounts dissipated July the 1st, and so now they just recognize it as Local Public Health Services HFI.
Great. Any questions or concerns? Okay. Dr. Brucken?
Don't have a whole lot. We had a wonderful meeting with the guys that came over from the state office. Thanks for everybody that was here when Dr. Weaver came. Great afternoon, a lot of talk about the funding that's coming about next year, so everyone's excited about that. Outside of that, just kind of finger on the pulse of the medical environment. We obviously had some big changes with Union Hospital announcing its acquisition of Regional. And you guys remember that was all orchestrated through a COPA agreement oversought by the Indiana State Department of Health. So ultimately, there should be public benefit by definition at some point. So we've got obviously some changing times ahead. All area hospitals are seeing an uptick in COVID positive cases, not necessarily being admitted due to severity of illness, but a lot of COVID adjacent things. A lot of little old ladies that are dehydrated and have some renal insufficiency because they're not eating and drinking. We're not seeing folks showing up with lung issues like we did initially. So, but everyone is collectively seeing an uptick for sure right now. Outside of that, that's all I have.
Is the Board of Health going to do the COVID thing, Johnny?
The COVID what, Dr. Lim?
Injections?
The vaccine?
Yes, and I'm going to let Chelsea Willis, the Director of Nursing, address that in her report.
Okay.
Great. Joni?
All right. The main thing that I've been working on this last quarter was obviously the Healthy First Indiana and being able to wrap my head around it and how to do it. If you remember at our July meeting, we had Mike Sutton here, which was the new regional administrator. And then he met with Mike Morris and I the next day, and then we watched Zoom, participated in a meeting with the State Department of Health. And it just kind of all fell together and became very clear. Where you've heard us say before that we have such a well-rounded health department that already does those core services. So what light bulb finally went off on top of my head was this isn't just about the health department, it's also about community health in Vigo County. And so that's what we looked at in the 2024 budget development. Yes, it has things like training and stuff like that to enhance our staff and to help boost up salaries for people who are now going to take on extra responsibilities. But outside of that, it was just working with other entities on what our county needs the most, identified in that short amount of time. And what I'm going to do between now and the end of the year is identify people to bring together in January to start working on that 2025 funding, which will be double the amount. And that may also be, I've kicked it around and had just a little bit of emailing back and forth, maybe having the Wabash Valley Community Foundation handle the RFP process, the request for funding proposals, because I think that's bigger than our health department when you're looking at over $2 million for community-based funding. And so that was probably the primary thing that I worked on over the last 3 months. But I also had some really good news that the State Department of Health and the IU School of Medicine asked if we would be the third county to participate in a pilot project. They're looking at adding a public health rotation as required versus an elective. And for any of you that are familiar, we've had IU School of Medicine Terre Haute students with us on and off for about 17 years, and they'll do an elective public health rotation. So they were both entities were really pleased to hear this, because all it'll do is just expand on what we're going to do, and that it'll be one student with us for a 4-week rotation, and we're going to start that in January. So I was really pleased that they thought of our county, and I think part of that was the great reception that at the meet and greet that we put on for Dr. Weaver, and just the enthusiasm of the turnout from all the community members in Vigo County. But outside of that, I've just been a super busy beaver on the HFI funds.
And I think the fourth-year medical students, I think, have maybe 6 electives in their year. And they use them a lot if they want to do a residency some other hospital.
Right.
They use some of that time to spend a month here, a month there, and
Right.
you get to know when they go to apply for those positions. But so they have an elective time, to do that, and I think that would be a great program. And then probably 6 or 7 years ago, you're now able to get a master's in public health while going to medical school. And we've had a couple.
Oh, yes.
And
That's
it's
common.
very difficult. You not only go to medical school, but you're going to end up with your MD plus an MPH, which takes, a lot of kids can't do it. But they've had 3 or 4 in Terre Haute over the years. I've kind of lost track of it lately. So that's another public health stuff that we're training those students here in Terre Haute. And that may be the trigger to do that elective to say, maybe I want to get a master's in public health.
Yes, that's what Anthony Ton, he finished medical school, and then he chose his master's in public health. When I sit on the NSACHO Board of Directors, and we went to the poster presentations for Fairbanks School of Public Health. What was impressive is that dual degree program of medical that can also be public health or law. And I was just blown away at some of the presentations that the students had.
That's a great program.
Jenny?
Thank you.
All right, now on to new business. Amanda?
Okay, so we have our body art ordinance and our wastewater ordinance that we are currently working on updating. Body art is done, so I will be punting that out to you guys to review so that we can vote on it in January. Some of the major changes in that ordinance would include like the distinguishing between the different types of artists, so tattoo artist, regular tattoo artist, temporary artist, eyelash extension artist, microblading, that kind of stuff. We have changed the training hours for the artists from 6 months of training to 500 hours total, where they could do 2 hours a week for 6 months and get their regular artist license. So we want them to have a little bit more training under their belt before they get their regular artist license. With the new HFI things coming down the pipe, eyelash extensions is going to be added to our rule. So I had to add that whole thing into our body art ordinance. Those are the major ones with the body art. With the wastewater, we actually just met today over it. There's some major revisions coming down the pipe from the state. I can have Cheryl come up and elaborate a little bit more on it. But what they're wanting us to do is do our revision, turn it into they have a pre-planning committee, turn it into them for approval. Then they'll give it back to us, then we submit it to you, you guys vote on it, and they want us to take it to the commissioners, have them vote on it, then submit it to the state for approval, and they may not approve it. Then we're back at square one with bringing it back to you guys, commissioners, so on and so forth. But some of the revisions they're wanting to do include like holding tanks.
which is something that we haven't allowed for years. It's kind of a last-ditch effort when no other system would be available to make a home viable. A holding tank would be something that has to be pumped every week, 2 weeks. There's a huge cost involved with that. Not something that we really want to do, but they have now allowed it. If we choose to approve it for someone, it kind of, like I said, would be just a last-ditch effort when a regular system would go in.
So they're wanting us to permit it, then follow through with the maintenance on it, so they would have to submit paperwork to us every 7 to 10 days on
Every
the
time
pump,
it was
or every
pumped.
time they pump it. And then they want us to do a yearly permit or a 2-year permit on it. They're giving us requirements, but it's just like the fee,
Be a
or the
lot of
possibility
legwork,
of it
lot
for,
of legwork involved, because we have to verify that they are indeed doing what they're supposed to be doing. They have a signed contract with a wastewater hauler to come in and actually pump that out every 10 days, 2 weeks, 3 weeks, however long it would take them to fill up, their tank. There'll be a lot of legwork as far as permitting and verifying that they are doing what they're supposed to be doing, handling the receipts.
so
There's a-
that's like one of the major changes of the rule. What was the other?
Basically, they will not allow county ordinance to be more specific, more stringent than the state ordinance, and didn't affect us as much as it did some other states. A lot of states and other counties had very strict ordinances that made it almost impossible. You had to have a minimum of 2 acres. You had to have a set-aside, meaning that, in 40 or 50 years, if your system failed, you had to have areas that you could put a secondary system in. We don't necessarily have that in our ordinance, but we do have some things that were more strict than the state. So we're going through and trying to find out what's the most feasible line that we give to them. So hopefully we'll get this thing approved first time around.
So, and not only with that, when we submit this, we also have to submit a cost analysis sheet for them and a whole nother application stating the changes that we made and why we've made it. So there's gonna be a lot of work involved in all of this. So once we get a little bit more of a bigger grip on it, we get something in writing, I will print that out to you so you can review it like a foreign language. But,
We'll get there.
then the other thing along with all of that is updating our fee ordinance, or fee schedule. So I'm gonna be working on that also. So those are my major updates.
Amanda, is threading in the body art ordinance?
Threading,
Oh, that's
and
interesting.
it's not in the state rule either.
Because I thought there was a herpes outbreak, because don't they put part of the thread in their mouth and then they do it?
They do, but it's not in our,
my
not in our ordinance. And we just went to
Yeah.
conference last week, and we kept hearing people say, nail salons, and they're bringing up nail salons. I'm like, okay, wait a minute. So we finally pulled somebody aside, like, what are you talking about? Because we haven't heard anything about nail salons. But a lot of counties are putting requirements for nail salons in their ordinances because they see the state for changing the rule to where we will start having to regulate the nail salons. Yeah. So, do what? We can. With the HFI funds, we will be bringing on another environmentalist in January. Joni's put that into the funding. So that'll be Andrew, hopefully. And he will be focusing on helping out with septic, and then we're gonna get him trained in mold. So we can have somebody that's a specialist in mold that can go out to the homes, because we get a lot of complaints on mold, and so forth, so.
Who is, just ask you a question. There's a lot of estheticians and non-medical professionals doing, injections, fillers. Are they regulated by Board of Health or by the state?
By the state. The eyelash extension part of the rule says they have to be a licensed cosmetologist or an esthetician. or been through a certified program that's recognized by the state. We have a list of those
But you
that the
don't-
state's punted down to us.
But Board of Health is not,
So,
because even dentists are doing cosmetics procedures now. They're licensed in dentistry, but
yeah.
I don't know.
Any questions? So, yeah, I'll have the tattoo, body art stuff out to you guys within the next week.
Great. I see we have the new dates for next year.
Yes,
Yeah.
I had changed them and, moved them up, the two that would be conflicted with early voting, but it was a burden on a couple of the board members' schedules, and it also is for us to be able to put together that completed quarterly report, because let's say like this last Friday was the 29th, so we were still doing business, and it'd be hard to have it everything compiled and punted back out. So we just thought we'll just all squish like sardines for two of those meetings like we've done in the past, and that'll be all right.
That's fine. All right, any other new business?
Yes, yesterday the county commissioners amended our clean indoor air ordinance to include vaping. The city had modified theirs, and so to even the playing field and to keep up with what's important to keep our community healthy, the commissioners unanimously voted that into play. So I know at least Andrew took a cranky phone call today, but so be it. But we prepped everybody on talking points and sent that even to the commissioner's staff and to the commissioners. I'm sure they're going to get questions also from the media or from the public. So, what a long way we've come since we first started with clean indoor air ordinance.
All right, old business. Joni?
All right. The budget was due to the State Department of Health by September the 1st, and that was taken care of. And then I submitted it to the Vigo County Council. They were able to advertise it and run it through the first reading with the 2024 budgets for the county. So it has made it through the first reading. There isn't a second reading as of yet for all the budgets out of last night's sunshine meeting, because the budget committee staff people told me that they still have things that they're tweaking and working on, and they may have a special meeting, but hopefully get it done by November so it can be sent off to the state to certify. Mike Sutton sent me an email and told me that our budget had been approved, there were no amendments needed, and so it's on its way, and it's exciting.
That's awesome. All right, program updates. Loretta for Vital Records?
I am Robin Poor. I'm filling in for Loretta today. So Vitals has been busy this quarter with our walk-in appointments, also with our mail-in appointments, or our mail-in orders. And then we've also been doing a lot of court orders lately, legal name changes. We've seen a spike in that. Also, the weather will be changing soon, so we should see a spike in the homeless needing birth records. So we'll try to work with the individual as much as we possible. Most of the time, we work with their case manager or their social worker that they have. We do have our credit card machine up now, so that's been in place, and it's working pretty well. We haven't had any issues with that, thankfully. Also, on October the 12th through the 13th, Loretta and I will be attending our fall conference. It'll be our first fall conference since the COVID. So we're pretty excited about that and seeing all the things that they're wanting us to implement. Other than that, that's about everything that's going on in Vital Records. If there's anything that you'd like to have added to our report. Loretta also wanted me to mention that if you guys would like to come by and see how we run the office and how we process the birth records and the death, that you're more than welcome to.
And it's a treasure trove of natality and mortality info.
Yes.
That's-
Thank you.
Any questions? Thanks.
Thank you.
You're welcome. Thank you.
Amanda?
Okay, so the environmentalists have been staying busy with staying on their daily tasks. We've had an increase in lead cases this last quarter. I think we had 15 risk assessments that we had to do. So that's quite a bit compared to what we normally do. As far as staying with festivals, septic installs, we're just downright busy. Seems like we're opening, 2 mobiles per week? Doing the yearly mobile permits every week, about 2 of them. That's a lot. yeah, we're just staying busy. Let's see, what else did we do? Amanda and I met with the CEO class at the station, which is a Vigo County School Corporation program of young entrepreneurs, to talk about food safety, and they had a bunch of great questions. It was a really good Q&A with them. Let's see what else.
I would just like to say, I've never seen you so busy. I look at those every time they come out. I've been sending notes back to you, but wow, I mean, I don't know how you're keeping up.
With the food inspections? Mm-hmm.
Oh,
Yeah.
and you're kicking some butt out there too. You're just not passing people through. I mean, so
On
hopefully
top of
with our new grant, we'll be able to get some more help. I mean, you're scrambling, gotta be scrambling.
And the staff is really great about staying up to date with their trainings. We have food trainings once a month on Tuesdays. The state's putting those out. We're getting ready to go to another food training coming October. Septic's got some trainings coming up. Getting ready to send a couple other people out to become lead risk assessors. We just hired a new employee. Emily Melton left. So we have a girl by the name of Anna Bunch. So she's young and exciting and willing to learn too. So we're busy doing that, getting her trained, and yeah, overall, that's it.
Do you think our lead cases have increased because of the drop in the cutoff level for lead exposure?
Absolutely. Absolutely. I will say, in the last 3 months, we've had actually 2 places that's done clearance, which is a rarity. So people are taking it to heart and actually trying to do something to take care of the hazards.
And you've had some pools close. You've had a couple that just could not get bacteria out of the water, or they closed just because of the season, or?
So some are failed water testing. If they fail a bacterial water test 2 times in a row, they've got to close when they pass one. And then some of the other closures are just a variety of reasons, like not enough chlorine in their pools protected, or some other public health hazards going on.
Any other questions?
Thank you. All right, Mike, with vector control.
Good afternoon. Let's see, we finished our tar amnesty program. We ended up this year with 5 semi-loads of tars, almost about 5,000 tars taken out of the community. We've sent in 83 pools of mosquitoes from Vigo County. 10 of those pools have tested positive for West Nile virus. Of course, everybody knows it's a drought. We're 7.5 inches below normal rainfall, so you have a lot of Culex mosquitoes out there, which that's your vector for West Nile. We've sent in 13 bats for rabies testing. All were negative for rabies, so we're good on that. I kind of brought you some numbers for Indiana. They tested 571. They've got 571 positive pools, the state of Indiana does. And they've got 88 counties out of 92 that have tested positive for West Nile virus. So it's statewide. It's not just here. It's all over the state. We've had 6 human cases of West Nile virus in the state of Indiana. No deaths. State of Illinois has had 3,292 positive pools of mosquitoes, a lot more than we have. 81 human cases, and they've had 5 deaths. So they have reported deaths in the state of Illinois. So we're kind of fortunate. We're getting cooler weather coming in, thank the good Lord. So it's going to put a damper on it. Once it gets below 50, 60 degrees, they become dormant, so they're not active. So I'm looking forward to that. We'll be winding down, but we're staying busy. Anybody have any questions?
This is a bump, isn't it, Mike, from what we've seen?
Oh, this
2 or
is a
3
big bump.
years?
Yeah, this is a big bump, and it's due to the lack of rain. Every year, I get up here and I tell you guys, I want rain, I want rain, I want rain. Rain means you have more mosquitoes, but you have more of the Aedes species instead of the Culex species. Culex prefers the dirty, stagnant water that's left behind in cups that people discard, and tars in their backyard or children's toys. You hear me talk about it all the time up here. That's all the water that's out there right now. Most of our larviciding sites, what I call our larviciding sites, are dried up. You know, it's just what people have in their backyards that's breeding mosquitoes right now. So this is the bump that we normally don't get, but with 7.5 inches of lack of rain, yeah, it's expected, you know.
I wonder if they've studied what kind of professions are at higher risk. I mean, you'd think farmers might be, but you never hear Farm Bureau anybody talking about West Nile. You know what I mean? Like a farmer put on mosquito repellent borders out in the field, but you'd think those would be some of the higher risk people, I would think.
Yeah.
I don't know if that's been shown who the high risk people are, but I've never seen anybody talk to farmers about, we talk about other, it's a dangerous profession, obviously, other risks, but I don't think we've ever really discussed this.
No, I
It's an issue
haven't.
for them.
No, I haven't either.
And I'm curious if it is, but you think it would be.
Yeah.
Did you read the article in Sunday's New York Times on mosquitoes in Africa?
I'm sorry?
Did you read the New York Times, your Sunday New York Times? There was a very interesting article on mosquitoes and mosquito control programs in Africa. I will print it out, scan it, and punt it to you.
Was it this Sunday?
Yeah, yes.
See, I'm a retired man, and so the New York Times, I have to read at the library
Okay,
4 days after it comes out.
Okay.
So I go up there at the I'm up there at the other old guys, look at the Sunday New York Times on Thursday. I might swing by tomorrow. So I'll catch up with it tomorrow.
yeah, see, I go hide out in the pool house. That's my Joni cave.
So, Mike, can I ask a question? Like, mosquito was born here, how long can they migrate?
It really depends. They're not going to fly very far because they only normally fly a couple 100 yards before they get a blood meal.
So all your mosquito source is from your own local growth?
Yes. Yes. That's why it's so important that you keep your grass trimmed and you check your property, your rain gutters and bird baths and children's toys and, you know, check for tars or anything on your own property and in your neighborhood, because normally they're only going to fly a couple 100 yards. Any other questions?
Do you know if we're working with Mental Health America and like homeless encampments? Because I can imagine they would have some stagnant water sources to
No, I
educate that
don't.
population.
Not so much with the encampments on that, but we have provided the Homeless Coalition and the PATH program, mosquito repellents, things that you don't think about that homeless people would need. We worked with Walmart and with one of our chemical companies, and they were able to help us out with that. But there's all those little things you don't think about that are homeless, but as actual water standing, no.
You're not giving out free syringes, right? Not like big cities.
No.
No, we can't do syringes. Right.
Thank you.
Mike. All right, Chelsea with the clinic.
I always feel weird getting up here, but
You're doing great.
so we had our Back on Track event with MD Wise. Ended up having 88 kids come through and 190 vaccines given. MD Wise told us that was the biggest event they've had in the area. So it was wonderful. The food pantry dropped off a truckload, a semi-load of food. We had bounce houses, Chick-fil-A catered. Turned out to be a wonderful event. We've been still continuing to push the employee HEP A's and B's. Jane Keys has come back to help work on those. We've done some TB testing for the employees at Head Start, as well as been back a couple more times to do lead testing on the new enrollees. Now, let's see. We had what the state classified as a Strep A outbreak at one of the nursing homes. It was a total of 2 cases, but 2 with 1 resulting in a death classified as an outbreak. We had a couple calls with them. State's going to go in and do a remediation with them. I haven't seen any more meetings come up yet, but I'm sure there's one, they're gonna have one soon. The employee flu vaccines have started. We do those every Tuesday from when we open to when we close. We have a new nurse that started, Jamie. Wave, hide. Libby has dropped down to PRN. And Kim is no longer with us, so I'm training Jamie, and she's my guinea pig for our new employee handbook and training. We're working with St. Mary's on scheduling a COVID vaccine to go out and do the sisters. And we did the community baby shower, Union's community baby shower last weekend. A lot more informative information than it was actually vaccinating, but it was great to be there and to see how everything works. And we had Ben Franklin had a little pop-up back-to-school bash that we attended to help catch up some of their kids. It's an area that they have a lot of issues getting the kids vaccinated in. Let's see. We have the RSV vaccine in for our private stock. I just got that in today. I have the COVID vaccine in for 5 and up for our BFC program, and I've got it in 317, the adult program. There was a holdup with our private vaccine for COVID that's something to do with the shipping, so it's not here yet. They can't give me a date, but we're hoping it's really soon. We get 20 plus calls a day. So. And then we are going to do a couple walk-in lead testing days for the lead prevention week, which runs from October 22nd to the 28th. You guys have any questions?
You're working hard. The COVID vaccine, will there be a cost for it?
It is, there is a charge now, it's not free, but most insurances are going to cover it. I did have a lady come in though today to try to get the RSV with Medicare, and it was not covered yet, so I'm hoping it's just the lag and it'll pick up soon.
So what did you have to charge?
We were just gonna hold off until she's able to get it through her insurance.
A couple of questions I was looking at. We don't see salmonella very often,
We don't.
and giardia. Were these foreign travel, or do you know any of the sorts of those?
The salmonella, most of them were all
From
in
one place?
town.
Okay.
A couple babies, a couple young kids, which is out of the ordinary. A couple of them were still on formula.
Really?
mhm.
I've never seen that. Have you?
No, not
You guys-
usually. Mm-mm.
Okay.
And we had another lady that was sure that she got it from Walmart's new chicken cold cut deli meats, because that was the only thing she changed in how she was eating. But
But these talk about pet turtles as a
Yeah.
transmitter, but, and then giardia is usually contaminated water, but I didn't know if anybody traveled overseas or if anything like that.
those ones I can't recall off the top of my head. Like Libby worked those, and they're not sticking out. I don't know if we came up with, or were able to narrow down a reason for those ones.
I wonder if the salmonella people got very sick.
The
Some
ones,
people just sort of smolders, it doesn't really, they don't die from it usually, but.
no, and the ones that I worked, they weren't really sick. They were usually over it by the time we got a hold of it, so.
And then the hepatitis C number is still the federal prison number, it's still large, or
I split them up this time, so the FCI
is the federal?
is the federal, yeah.
So still quite a few.
We do, and a lot of them are, we see the older population that are just getting tested and have had some drug use in the past, or some blood transfusions, things like that, that just have gone unnoticed for,
And were too old to be vaccinated. You know, they didn't go through the usual
yeah,
vaccinations like children do now, so.
right. But they do offer the medication plans now. So usually they get referred out to Jaffrey, or usually Jaffrey. And we've got a lady that comes in that can also help them get hepatitis C treatments.
Because it makes you high risk for hepatic cancer, of course. It's a big risk factor for cancer. Thank you.
You're welcome. Anybody else have any questions? No? Thank you.
Thank you. Shelby?
All right, hello. It's great to see that we're all still here and we didn't turn into zombies after the emergency alert was practiced. So in my report, you'll see some of the project's presentations, meetings, some media topics and contacts. So last month, we finally got the installments installed into all of the restrooms here in the annex. So we did a September suicide prevention awareness push. This month we did the National Lead Prevention Week. So it was themed around Halloween. If your haunted house had been built before 1980, has your ghoul or goblin been tested for lead yet? Some of those attractions to get people's attention. And those were just installed today. There's also a monthly newsletter with HR that went out for October. This is also Public Health Literacy Month, and it just kind of explained, how we can increase health literacy, and if we don't increase it, how that affects our hospitalization, and some of the money tied into that. So that was a fun one to put out, as well as the employee shot flu clinic dates and some information. Next, you'll see the non-syringe harm reduction program. These are the numbers of dispersed kits. So when state contacted us, we had a huge number, actually a spike of those with HIV who were using IVs, drug use through IV, and it's great to see that the biggest number of dispersed kits are with IV drug use. There is also some with wound care, some Band-Aids, some sterile water, Neosporin, stuff like that, as well as smoking harm reduction kits. Those have been given out to secondhand organizations. It's not from me to a person, but those secondhand organizations already know those individuals and have that relationship. So that was great that they were able to get those out into the community. Other than that, the public service announcements continue, interviews continue, and this quarter, excitingly, we got on the radio station. So if you haven't heard yet, on High 99, we are airing a commercial for the clinic, talking about services, hours, and the after hours for the Tuesday clinic. So that is great as well. It's on 2 times a day, sometimes once a day. And we can change that messaging whenever. So it's a 6-month contract, and it is my idea to hopefully get back in the studio soon to change that for Lead Prevention Week. Just because I haven't heard any commercials so far focusing around lead. There have been a lot about flu, so I don't want to reciprocate that any more than it already is. So that is my next idea and goal to achieve. You can see the events that I've attended, but lastly is our social media impact. Now we are only on one app, but still the implications, the engagement, the following has all tremendously grown over the past quarter. These can be linked to a few things. I've been putting the location on everything, so if people who are using the app have their location on their phone, they'll be signaled or they'll get those messaging systems. But I'm also using a whole bunch of variations of hashtags. So it's great to see that we are getting some more involvement, although I need some more male involvement. It's typically the standard Caucasian middle-aged woman, and we need to get some more men on there to try and get them more active. But other than that, that is my report.
And I want to expound upon the tick and HIV cases that are intravenously drug related. We've connected the Indiana State Department of Health HIV division with our county jail, and they're working to do mass testing there. If they can get enough blood in a tube, they'll also do it for syphilis and hepatitis. But they've got peer educators that are going to come down and talk to the incarcerated and just try to see and let them know that HIV is a manageable disease like any other disease. So I'm pretty excited about, I'm hoping in January I can come and report something great on that.
Shelby, if I could ask, did we have to pay for the radio commercials, or is it part of their public service?
We paid for it.
It's part of the immunization grant.
Because I know media has to do so much public service, don't they, to keep a license?
I don't know.
Although the statistics with radio advertising is tremendously more than billboards. We talked about billboards, but the cost with that versus how many people drive past a billboard in a day versus listen to the radio. So that's why we decided to go with radio.
Just once in a while we hear this is a public service announcement by the station. So there's something out there. Okay. So it's not that.
And we were fortunate with the Indiana State Department of Health immunization grant. You remember they approved our $75,000 from July 1 until June 30th of next year. But then they came through and gave us extra supplemental funding at $129,000. So it allowed us a lot of creativity that we can do to try to get our services out there.
All right, thank you.
Thank you. Do we have any citizens input? All right, anything else? Our next board meeting will be January 17th. And I motion to adjourn.
A motion for adjournment?
Second?
All those in favor?
Yes.
Opposed? All right, thank you.
Thank you.
Thank you. Thanks, everyone.